A 3-year-old patient with a past medical history of frequent respiratory infections is evaluated for difficulty walking. Cultured cells from the patient reveal a high rate of radiation induced genetic mutation. This patient is most likely to experience which of the following? Now, we have a 3-year-old patient who has been experiencing frequent respiratory infections. So, this kind of tells us that there's some sort of immune deficiency going on. Patient has also been experiencing difficulty walking and also has high rates of genetic mutations. Now, these symptoms should remind you of a disorder called ataxia-telangiectasia. Ataxia-telangiectasia is going to be due to a mutation within the ATM gene. The ATM gene is going to be important for repairing double strand breaks that occur within our DNA. Now, as a result of a defective repair system, we're going to have accumulation of mutated cells within the body. Now, when we have an accumulation of mutated cells within the body, our body is going to try to kill off those mutated cells. And when it starts killing off those cells, it can also start killing off important brain regions. And one of them is going to be the cerebellum. So patients with ataxia-telangiectasia, they're going to have cerebral atrophy. The telangiectasia part in the name of the disease is going to be referring to the dilation of blood vessels that we see in these patients. So here, there's going to be dilation of the blood vessels that we see. In this picture, we see dilation of blood vessels within the ear, and we also see dilation in the skin. These are going to be spider angiomas. Now, due to a IgA deficiency, patients with ataxia-telangiectasia are also going to be at risk for sinopulmonary infections. So here in this question stem, we see this 3-year-old with frequent respiratory infections. So also in the question stem, watch out for frequent infections in these patients. This is going to be an MRI of a patient with ataxia-telangiectasia. Here we can see the cerebral atrophy going on. So if you notice, the cerebellum is much smaller than what it should look like. Here's a mnemonic that might help you with all the things going on with ataxia-telangiectasia. So remember ataxia-telangiectasia with 4 A's: the ATM gene mutation, the ataxia, the spider angiomas, and the IgA deficiency. Here I have a summary of the pathophysiology that is going to be going on with the disease, if this helps you.